Welcome back to OpenLine. I'm here with Dr. Jennifer McLaughlin from Elite Audiology. You're giving me some tongue twisters tonight. We got a lot of vowels in there. We're glad that you're with us too. We're talking about hearing loss, how to combat it at any age. So if you have a question, please give us a call. 615-737+ is the number to call. We'll leave that up right there along the bottom of the screen. Hearing aids have come a long way.
Yes, they have.
Can you give us some examples of what's out there now?
Sure. Well, the most surprising thing that people will say to me is that they're shocked that we now have hearing instruments that can sync directly with your iPhone and your iPad. Yes.
Really?
It's actually your Bluetooth headset, and it looks like this. I don't know if they can see that.
Yeah, we've got it right there.
Okay.
Perfect.
So,
actually hold it down just a little bit right here.
Okay, like this. I'll even put it on the ear.
Yeah, that'll be good.
There we go. And that would normally go in the ear canal. But yes, the signal, actually there's a Bluetooth chip that's built into the actual hearing instrument, and it picks up the signals from the phone and iPad, so you can even stream music and videos and things like that, as well as phone calls.
Wow.
You can also use an app on your phone to make adjustments to the hearing instrument. You can increase and decrease the volume, change to the different program settings. It has a hearing aid finder. If you lose your hearing aids, it'll take you
That's huge.
to where it is.
Yes. Okay, now that is very cool, and it's awesome, but it can also be very intimidating, especially for someone who may be older and there's like, I don't want to deal with all this technology.
Yeah.
But when people come in and they get this hearing aid, do you help them figure all that out?
Of course, yes. I help everyone sync the instruments with their phone if they already have a smartphone. If they don't have a smartphone, I encourage them to get one, but if they don't have one, it's fine too. This technology is excellent. We have come so far as the signal processing has gotten so much faster, which means for the patient that the hearing instrument is better able to sort out speech from the background noise signal. So it can automatically adapt for the different environments that they're going into.
Now you mentioned you can stream music and get your phone calls through there. But it's still a hearing aid. I mean, it's still just to hear life around you.
Oh, yes. And people many times will come back in after even their first fitting and say, it sounds great, don't touch a thing. I've given your card to 3 people already. I mean, it's
That's
really,
the biggest compliment. That's great.
Yeah.
Now, this one's a little noticeable, not huge by any manner. I mean, we used to see, I remember my grandfather used to wear them. It was, a huge hearing aid.
Right.
These are small, but I know they come even tinier.
They do. We have smaller options, and this is not even the smallest option, but there's one that's called completely in the canal. And so it might be visible if someone were looking directly in your ear. There's one even smaller than this. It's called invisible in the canal, and it's all the way down in the.
Does it stay there permanently, or do you take it in and out every day?
We take these out at night. There are some that are able to stay in permanently, and they have kind of mixed results.
Okay.
Some people are not able to tolerate those staying in their ear for more than about 2 months is typically how people deal with that. But there is also surgery that can be done and different things like that. So,
what about care and cleaning of these hearing aids? What goes into that? What should people know?
Well, I always do a big overview of that also at the fitting appointment. But if anyone is having a problem with their hearing instruments and it's a good battery, because they are still battery operated, the next thing to check is the little wax guard. Almost every hearing instrument has a place where wax can get into it and cause it to malfunction or shut down. So checking the wax guard, knowing where the wax guard is, and that's helpful for loved ones also, because if you're helping someone who's maybe their manual dexterity is not as great.
Yes.
It's good for the loved one to come to the appointment so I can go over everything with them also as far as cleaning.
What are the complications that people usually run into? You know this far better than the questions I can imagine. So what are the problems that people run into? They come in and say, this isn't working.
Well, I mean, background noise is still, a concern. A lot of times what I've found is that some people will forget to switch it into their noise suppression program if they don't have, the more automatic features. And so I have to say, well, did you put it into your program too, or your restaurant setting? And they'll say, oh, I forgot I had that. So it takes a lot of practice. to get into the habit of switching it for the different environments that you're in.
What about that squealing sometimes you hear from the hearing aids? What's that?
That's feedback. That's when the instrument, when sound or the volume is coming out of the speaker or the receiver and circling back into the microphone, that creates a feedback loop. And that's normal for it to happen when if the battery door is closed and it's sitting on a desk or something like that. It should not happen when it's in the person's ear.
Oh, okay.
A few things that can cause that are wax in the person's ear that can kind of stop the sound from going on its path. So that's one big thing to check. The instruments now have what's called automatic feedback suppression. So the instrument can detect when feedback is present and eliminate it. It generates a tone at the exact same pitch but the opposite sine wave pattern to kind of cancel it out.
Wow.
And so you don't have to worry about your grandparents' hearing instruments squealing and bothering the whole family.
Right.
So.
Well, it's not that tough, but it startles you, and then you think, oh my gosh, what does that sound like in their ears? How terrible. How terrible.
And sometimes they can't even hear it.
Yeah. So maybe not as terrible as we think it is.
Right.
I want to talk about kids, and and even me. I go to the gym. I have my earbuds in. You see a lot of kids with their big, headphones on. Wow, I can only imagine the damage we're causing.
Right. There has been an increase in teen hearing loss in the past few years, and so we always encourage families, if anyone in the family can hear the child's earbuds and hear what they're listening to, they really need to turn it down. We can do a lot of damage. There's not a lot of limits built into the audio devices, so I recommend, like if you're at the gym, if there's one song you really like and you really want to turn it up, maybe for one song, but then try to turn it back down. You don't want it to be over 80 decibels for an extended period of time.
How can we gauge 80 decibels?
Well, you can get a sound level meter app on your phone if you want to be that scientific about it. But especially if it's hurting, or like if you can hear it in someone else's ear, that's way too loud.
Should you be able to hear conversation still, or?
Yes, that's a good rule. If you could still understand if someone else is talking to you, at least know they're talking and be able to take out your earbud. That's a good thing.
Is it bad that we're using earbuds so often? I mean, no matter the level, is that a hindrance to our hearing?
Well, there is a time and volume kind of trade-off. So the longer you're listening, the lower the volume should be.
Okay.
Or, vice versa. If you, like I said, if you wanted to listen to one loud song, just try not to make it, more than a few minutes, and try to turn it back down. Turn it to the left is what we say.
Is there a difference between the headphones and the earbuds, because the earbuds go in?
Right. Well, some people, it's kind of what works best for each person. Some people's ear canals can't hold the earbuds really well, and it is a good idea to get the noise canceling headphones, because then typically you don't have to turn it up as much. Because
that makes sense.
If you're on the treadmill or something like that, you're going to cut out that noise, and then you don't have to turn up the volume of the music as much.
So with kids, the rule needs to be, if we can hear the music, it's too loud.
Yes.
And you need to turn down. Or if you can't hear us having a conversation around you, it's too loud. You got to turn it down.
Right, and that's good for safety also. They need to be able to.
What about for little ones? We're all going to be going out for summer activities, fireworks, sporting events, and then even adults going to concerts. Maybe you're taking your kids too, I don't know.
Right.
But when do we need to have the headphones on them to cancel out that noise?
Definitely if you're around fireworks. I know the last time I came to the fireworks downtown, it was extremely loud, and I think I'd forgotten my earplugs, and I was like, destroyed. So, but yes, anytime you're around fireworks or loud concerts, depending on, hopefully a child's concert wouldn't be that loud,
too
but
crazy,
like a teenager,
too rockin',
And you can get, if you're a musician, we have custom-made musicians plugs, or if you go to a lot of concerts, and they actually have a music filter kind of built in, and a speech filter, so you can still understand the people with you, but you're just lowering that music level to a more comfortable and safe level.
Very good. Okay, we're going to take a quick pause from my questions and go to Sarah on the line. Sarah, thank you for being with us here on OpenLine. What's your question tonight?
Hi, I really wanted to know, I've read recently that it's not good to clean your ears with a Q-tip. Once you get out of the shower, I feel like I always have some water in my ear, and so I want to use a Q-tip. But I heard that that's actually damaging your ears, so I wanted to know what you thought about it.
Sarah, I'm glad you asked that because I wanted to ask about cleaning your ears. And I mean, it can kind of get kind of gross, but it's something that we all do or think
Right.
about doing. So
Yeah.
how do you do this?
Well, that's a great question and one I hear a lot. Q-tips are great for cleaning the outside of your ears and maybe behind your ears and for removing makeup, but you do not want to put the Q-tip down in the ear canal. The reason is the ear canal was designed kind of like a conveyor belt. It will bring the wax out naturally. The same way, if you've had a child with tubes, the tube will come out of the ear canal naturally. A lot of times when we use a Q-tip, we're pushing the wax further down in. And I've looked in an ear canal before, and it looks like the shape of a Q-tip.
Really?
You can see it, yes. So it is good to let warm water go down in the ear canal when you are in the shower or the bath. Warm, clean water from the tap is different than, lake and swimming pool water. But that's a great thing to do to kind of help keep the wax from building up in there. Also, a hydrogen peroxide rinse, once a month or something like that is a good thing.
How many drops of that hydrogen peroxide should you put in there?
I recommend to have it. If you have a helper, that works well,
Right.
or if you have a dropper, lay on your side, just kind of fill up the ear, let it sit for about 5 minutes.
Oh, that's a long time. Okay.
Yeah,
Yeah,
you
but
can
you
watch
gotta do
TV
sport.
or
Yeah.
do
Okay.
whatever, read something on your phone, and just let it sit for about 5 minutes and then roll over and do the other side. Yeah. And a lot of people only build up on one side, so.
Why is that?
I don't know why. I just, it just happens. Sometimes I'll look in an ear, one's completely clear and the other one's not. So, and that's easy. I do wax removal in my office, so, and I actually like to do it. So
That's why you're an audiologist.
That is.
No, I'm the same thing. With my kids, I'm just like, oh, I gotta get that wax out. But
Yes.
so you're saying I can't do that anymore.
Well, and if you can see it and it's
Yeah.
on the edge, you can kind of get it, but
Okay.
don't put the
Don't
Q-tip
go
down in
poking.
there.
No,
Right.
no.
And
Okay.
you can also, there have been cases where people have, I heard of someone who was traveling, and so they were in an unfamiliar bathroom, and they were doing that, and they bumped into the wall, and then the
Ouch.
Q-tip can go in too far, and that's really,
It's painful.
excruciating, yes.
Ugh.
And damaging to the inner ear.
Really?
Yeah.
How do you know if it's just you have a lot of wax buildup in there and that could be causing a problem? Is there a sign?
A lot of times people will hear their own voice a little bit more and hear yourself chew and things like that. You'll hear, a little hollow or echoey sound with your own voice.
What about ear candling?
I don't recommend that.
Okay.
There have been cases where people have burned their eardrum with it, but I have I have seen a few patients who kind of swear by it and they love it, and that's their choice. I'm not.
You're not endorsing it, is what you're saying.
That's
you can
right.
say that. That's fine.
Right.
That's fine. You're the audiologist. You can say exactly what you think.
Okay.
All right. On that note, we are going to take a quick break. If you have any questions like Sarah did, go ahead and give us a call. It's probably a question a lot of people are sitting at home wondering. So 737+ is the number to call. We are coming right back.